Hi, my name is Jen Hayward, and I'm doing my presentation on Hildegard Peplow's theory of interpersonal relations. Hildegard Peplow, she developed the theory of interpersonal relations, introduced the concept of advanced nursing practice, had a strong background in psychiatric nursing, and was an active leader in nursing organizations.
In studying interpersonal psychology, as I did at Bennington College, it occurred to me then and later that this was an important theory, that it had great relevance for clinical practice, and that the profession needed to know about it, and so I published a book. When you talk about my work, I don't think it should be limited to a book I published in 1952. I did other things. So I took personality theory and I showed that this is the theory, and if you apply it in nursing, this is what it will help you to understand about patients, and this is what it will suggest that you should do or might do that would be beneficial.
The theory of interpersonal relations is a middle range theory focusing on the relationship between the nurse and the patient. And according to Peplow, the nurse-patient relationship is the center of nursing. There are 3 phases to this theory. The first phase is the orientation phase. This is the phase where health problems have emerged and it results in a felt need. And professional assistance is sought. This is typically when a patient is seeking out help either at the hospital or clinic, or his doctor's office. During the working phase, the patient identifies those who can help. The nurse focuses on the patient and together working towards goals with them. The resolution phase is when the patient adopts new goals and frees himself from identification with the nurse. There are factors that can influence these phases, specifically the orientation phase when the nurse and the patient are first getting to know each other. So with the nurse, the nurse's values, culture, race, beliefs, past experiences, expectations, and preconceived ideas. And as you can see with the patient, those same things, the values, the patient's race and culture, beliefs, past experiences, and expectations. So those together, depending on what each brings to the table, that, together develops that nurse-patient relationship. Those are factors that can influence, a positive experience or, on the latter, a negative experience. The roles of the nurse. During this theory, Peplow identified different roles that the nurse takes on. The nurse can take on the role of the teacher, in doing so, providing knowledge about, issues going on with the patient. The role of a counselor. So in this role, the nurse is helping to recognize, face, accept, and resolve problems with the patient. A resource. During this role, the nurse is providing information to understand a problem with the patient. Surrogate. Oftentimes the nurse has to take the role of another or the place of another. So this, for example, if a patient presents to the hospital and doesn't have any family or friends with them, that nurse can fill in that role. Technical expert. The nurse provides physical care using their clinical skills. And leader. It's just straightforward. The nurse initiates and maintains goals throughout the interaction, throughout the patient-nurse interaction. Moving on to my clinical exemplar. Mr. Smith, he's a 48-year-old male presenting to the hospital with complaints of anxiety. Mr. Smith has a history of alcohol abuse and homelessness. He frequently comes into the hospital late at night, oftentimes intoxicated and presenting with symptoms of anxiety. And this evening, alcohol can be smelled on his breath. During the orientation phase of this interaction, the nurse is working with the client in the role of the counselor. As we discuss those different roles that nurses can take on, and the role of counselors, the nurse is helping to establish a relationship with Mr. Smith This can be achieved through active listening to the client and talking to him about what brought him into the hospital. Preconceived ideas about the patient should be put aside, as oftentimes these can affect the nurse-patient relationship. The nurse works with Mr. Smith in this orientation phase to identify problems. It can be challenging, and in this exemplar it is proving to be challenging due to the client being intoxicated. So, when a client is intoxicated, they're not always, willing to work with people who are trying to help them, and their thoughts aren't always clear. However, Mr. Smith does state that he wants help for his alcohol abuse, and he's sick of feeling like this all of the time. During the working phase, Mr. Smith has slept for a few hours. He wakes up feeling more anxious, but not as intoxicated. And he wakes up remembering the nurse who was with him earlier, so now the nurse and the patient are no longer strangers and are moving to the working phase of the relationship. The goal for Mr. Smith was identified in that orientation phase as getting help with his alcohol abuse and anxiety stemming from his ongoing abuse. The nurse in this working phase can often take on the role of resource, and in this case she is, working with Mr. Smith to identify resources for him. Calls were made to local detoxification centers and shelters. The hospital social worker was also called for a consult. In working on issues surrounding Mr. Smith's anxiety, the nurse can, through interpersonal interaction, facilitate the patient's ability to transform symptom-bound energy into problem-solving energy, with a resultant reaction and anxiety as the patient moves toward health. In the resolution phase with Mr. Smith, during this phase, Mr. Smith develops a level of independence related to his aftercare for his alcohol abuse treatment. The nurse takes on the role of teacher, providing information on assistance available to Mr. Smith, as well as effective coping strategies he can implement when feeling overwhelmed or anxious. Mr. Smith is able to explore his feelings, work towards his goals, and increase his level of independence over time during the resolution phase. Eventually, Mr. Smith adopts his new goals, which are getting into short-term detoxification and setting up an appointment with his counselor to discuss his ongoing anxiety. He then frees himself from identification with the nurse and is discharged from the hospital. Evaluation of this theory. So some strengths of the theory is that it's clear, it's easy to understand, it's easy to implement. Concepts of the theory are highly applicable to most nursing situations, as the phases of this theory are comparable to the nursing process that we're all familiar with. So the nursing process assessment is comparable to the orientation phase of this theory. Planning and implementation are comparable to the working phase, and evaluation is comparable to the resolution phase. Some weaknesses are that health promotion and wellness are not emphasized in this theory, and the idea of a nurse-client interaction is limited to those who are incapable of conversing, so those who are nonverbal or comatose, or those also who are withdrawn and are not wanting to develop any sort of a relationship with the nurse. So in conclusion, the theory is useful to most situations, like I said before, of nursing, as it emphasizes the importance of the nurse-patient relationship. According to Peplow, observation, communication, and recording are all interlocking performances in interpersonal relations that make it possible for nurses to study what is happening in their contact with patients. And this is from her first book that she wrote back in 1952. In the end, thank you for listening.